Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio, and delighted to be here on this beautiful Monday morning. We're going to be doing a spot check today around the metro to see how we're doing post-Labor Day and since school is back in session. On the phone, we have Dr. Larry Botts, a CMO at Advent Health, Dr. Mark Steele, Executive Chief Clinical Officer with Truman Medical Center, Dr. Raghu Adega, Chief Medical Officer at Liberty Health, and Dr. Angela Myers, the Division Director of Infectious Disease at Children's Mercy. Welcome to all of you. We'll turn to you for just a moment, but first, we're going to talk to Hawkeye. Hawkeye, how things go over the weekend?
Things are really good here at the hospital.
Yeah, really good. Look at you. You're pretty happy.
I'm happy. We are under that 20-patient mark.
Yeah, that's a big deal.
For acute infections. 4 in the ICU, but 3 of those, so 75% are on the ventilator. We still have 3 that are in that acute or that recovery period after acute infection.
Yeah.
And then, with those 15 people, again, 4 in the ICU, 3 on the vet, we do have 28 people who are still here for COVID reasons, but are not acutely infected. So in that recovery
46
period.
overall? That's better than we've been for a while.
I think we should be pretty happy with that.
That's good.
Keep pushing that number down.
We'll see how that goes. So, Hawkeye, I understand today's kind of a big day for you. It's your birthday. And so, team, I think we have a special message. Are we ready?
Here we are.
Okay.
It is showing.
All right. On 3, 1, 2, 3. Happy birthday to you. Happy birthday to you. Happy birthday, dear Hawkeye. Happy birthday to you. And will you please get rid of coronavirus right away? Thank you.
Yeah, nothing ages you like children and coronavirus.
Yeah, that's a double whammy
horrible
right there.
Combination.
Kids and pandemics.
Yeah.
Holy cow. Well, all right. Well, happy birthday. We're glad you've turned 40 again today.
Yes.
Again today. Larry Botts, how are things over at Advent Health?
Steve, well, I think we're doing pretty well. We're also down a little bit. We're down to around 13. We only have 3 people on ventilators. We have 5 in the ICU. I think at Advent Health, we've not had a lot of change over that 2.5 months, and our rate of hospitalizations has remained relatively stable. I mean, we had a little bit of a bump in end of July, but and we've had some decrease in the severity of our patients that are being hospitalized, a little less requiring ICU care and less patients requiring ventilators earlier in the pandemic. But our testing has been interesting. We continue to test all our pre-surgery and pre-procedure patients, and since we began testing this asymptomatic population, our rate of positivity really has remained fairly stable. It's been at 0.5%, and we've now tested over 10,000 of those patients, and so, and we really haven't had any significant change in the last 2 to 3 weeks, which is a good sign. Our symptomatic testing has showed an increase in positivity rate in the last 2 to 3 weeks. In contrast to the other one, it's up to around 20 or 25%. However, the total number of symptomatic patients that we're testing has decreased over that time. And so it's leaving us with the total number of positive patients or new cases are about the same as they have been for like the last 2 months. I think there may be a couple of reasons for this. During this time of the year, there's usually less viral infections, so I think there are less patients becoming symptomatic with something other than COVID and then getting tested. And in addition, it may be that our physicians are getting better at differentiating COVID infections from other causes of similar symptoms. I suspect that it may be some both. So I think that the trend over the last 2.5 months with little change in hospitalizations or not a significant increase in cases indicates that those infectious disease precautions that we've been put in place with our masks and our social distancing and good hand hygiene have all been very effective. I think if we want to keep our economy open, have students back in school, slowly get closer to something like normal, I think we need to be deliberate in continuing to observe those measures, which really have kept the disease at a level that allows our healthcare community to adequately care for COVID patients as well as other patients that are requiring our healthcare. So I just want to thank the community for their continued support for those measures.
Well, I think that's right. I think clearly the mask wearing has made a huge difference. Social distancing makes a huge difference. When people don't do it, we see things like the Sturgis outbreak or other really big concerns. Mark, how are things over at Truman?
Good morning, Steve. Things are good here at Truman, and we have seen a little tick down in the number of cases. We currently have 22 inpatients, although 10 of those are currently in the ICU, and we have 2 on ventilators. We continue to do a lot of testing, including for some nursing homes and for college students and athletes. We've also recently been thinking a lot about flu vaccinations. We'll soon be out in the community with flu vaccinations, I should say, and we'll also have more flu shots available at our drive-through stations. As always, we certainly encourage everyone to get their flu shot, as we do every year, but it's probably particularly important this year. We continue to hold steady at nearly 20% of our patients preferring virtual visits on their phones or computers to in-person visits. Patients certainly seem to like the ease of it, and many people just don't want to leave home still. And so people, if they want to get those, they can just call 404-CARE and someone walks them through the setup. And I would agree with Dr. Botts that certainly I think we are seeing the impact of people adhering to wearing masks and social distancing and so forth. So certainly very pleased to see that.
It does make a huge difference indeed, I think. All right. Well, thank you. Dr. Adega, how are things up at Liberty?
Good morning, Steve. We are actually doing pretty much the same as the other hospitals. I've been thrilled in the last 3-4 days to see our numbers go down. Unfortunately, a week or two, we did hit high numbers between 15 to 20 in-house at that time, but last few days we've seen many successful discharges. We currently have 8 in-house, 3 in ICU, 2 on ventilators. And that's actually a very good news. In terms of the kind of patients that we are seeing, we have not seen any clusters from long-term living places anymore. Most of these are coming from the communities, and many of them have some association with either social gatherings or family clusters. One thing that we've noticed is that for the most part, around here in the city, people are really adhering to most of the recommendations on masking and distancing, but we are seeing some transfers from smaller hospitals up north in the rural communities. So we do see some of that still going on. Hopefully, the message will reach the far communities to keep it up. Other than that, I think one other positive thing I can talk about is what our school districts and the local William Jewell College that we are partnering with are seeing. So it looks like they have really good plans in place, fairly large school districts, and none of them are actually experiencing any large-scale issues. They've been able to manage their plans with either a hybrid for secondary levels and able to keep their distancing and masking in schools, and that has really worked. So hopefully they can keep that up for the upcoming cold season, and they're always concerned about sports and watching closely. Overall, I think I do feel confident at this time.
Yeah, I think that's great news, and happy to see that getting a little better on some of those things. And Dr. Myers, how are things over at Children's Mercy?
Things at Children's Mercy are going really well. So, as you know, the majority of children who get infected with COVID have mild disease, and so we have no patients in the hospital right now with COVID infection. We, primarily see children in our outpatient urgent care settings and our ED who are tested and then are discharged home. We have noted an increased use of our drive-up testing recently, which has been wonderful, and we're able to service the community that way. I wanted to mention that in another month, kids are going to be getting sick with other illnesses besides COVID, and we need to remember that and be thinking about that. And then we need to make sure that kids are getting tested when they do get sick so that we can separate out COVID from other infections and get kids back to school as quickly as possible. And, Children's Mercy is well poised to help continue to support our community in getting that testing taken care of.
Dr. Myers, I will say, I think that's going to be one of our biggest challenges when these other things start picking up a little bit. What's the impact of that going to be, do you think? And which viruses should we be most nervous about?
Well, We typically don't see much flu before November, but sometimes it, really doesn't get started until January. So we'll see what happens with that. The Southern Hemisphere had a much lighter year this past season due to probably distancing and masking. RSV usually starts to tick up in November, so we should start seeing that as well. And then paraflu is a big cause of croup in the fall months. So we should expect to be seeing paraflu, rhinovirus, and then come November start to see an uptick in RSV and then flu.
Yeah, I bet there'll be a little more testing come November. I think our testing numbers, all of our testing numbers are going to go up, and they're going to start getting positive for other stuff. How are things out west at Hayes?
It was good. Certainly Dr. Diga brought up, his the sense that's out there.
Yep.
A little bit more rural than right here, but still.
Exactly.
But certainly out west with our rural partners at Hayes, they have 14 inpatients.
And that's a big uptake.
Yeah.
So I think that's what we're seeing, a shift from the urban areas, where I think some of the mask wearing has really taken a little stronger hold in businesses, et cetera. I think that's been great, and fewer gatherings and large gatherings. But in the rural communities where there may not have been as much mask wearing, it's starting to catch up, because 14 at Hayes is a big number.
It's a lot. Now, luckily, they're not critically ill, so they're not on the ventilator, so that's a good thing.
Yeah.
But certainly, that's a large proportion of their inpatient beds for sure.
And I think it's going to be interesting someday when the story is written about this pandemic, this transition from being overwhelmed, New York City and Seattle, or Italy or wherever, to kind of a disbursement then to the rest of the country in terms of the major urban cores. A problem, but not like it was in New York. And I think a lot of that has to do with distancing and some mask wearing, and then more and more mask wearing.
Yeah.
And then as the colleges and schools reopened and it got into the rural areas, that's going to be the next big thing that we really have to keep such a close eye on, both rural communities and schools opening.
Yes.
How's that going to go? And I think we've all observed, and it's fascinating to hear from all of our CMOs and all the medical leaders today. We're feeling a little better, but we're not feeling confident, and I think that's probably the distinction.
Yeah, absolutely. We know that although hospitalizations are down, both in Kansas, Missouri, Kansas City community, there has been an uptick in the rolling 7-day average of new number of cases.
Yeah, and we actually saw that nationally for the first time in a long time, an uptick in the total number as reported by Hopkins and CDC and the New York Times and others. So. Well, Jill, let's first off turn to media and see if there are questions from the media out there this morning. I hear a voice, but I don't hear a question. So, Jill, what do we got?
All right. We're going to start with Ashley. She's a 37-year-old mom who has no underlying health conditions. She has a 2-year-old son, and she was going to try to think about starting to get pregnant again until she read an article in the New York Times which talked about premature births and stillbirths born to women who also had COVID.
Well, Dr. Myers, do you see that as a concern? How much of a problem do you think that'll be for women here in the pandemic and for families?
So there have been some reports of premature birth, but it's not necessarily been truthfully attributed to COVID. So they've occurred, but not necessarily because of COVID. There's other many reasons to have premature birth. We have not had any babies who have been in our NICU who had been exposed to a COVID positive mom be positive or get sick from COVID. So I think if that is in your family planning, then and you are doing all the things you need to do to be careful while you're out in the community, then you should feel good about your plans.
Yeah, that makes sense, because that's kind of what we've thought. Dr. Adiga, any other thoughts about that as far as from an adult infectious disease look?
No, I think I agree with Dr. Myers. The risk has not been confirmed, and the risk is not terribly high either. And, if you're postponing your pregnancy by another year or two, you're also looking at, increasing the risk with the aging mother as well. So I think you have to balance all of those.
Okay. Yeah.
All right. Alex says that over the weekend, she learned that her son in high school will be required to wear a mask under his football helmet at all times. Is that safe?
All right. Well, let's first, Larry, you and I can tackle the safety aspect. I don't think for a young person who's in good health that wearing a mask is going to be unsafe. We know that it doesn't really affect you from a respiratory standpoint unless you have severe underlying lung disease.
I would agree with you, Steve. I think that's true. I think from a safety standpoint, it's not a concern for most young people. It might be a little more difficult, certainly, but not a safety concern from my standpoint.
It's not going to be comfortable, that's for darn sure. You start moving around, you get hot, you get sweaty. One of the questions, Dana, will be, is the mask still going to be effective once it gets wet out there in the field?
Yeah, that was a big concern of mine, especially as we're moving into colder weather. As you're breathing out more, there's going to be more heat hitting that cold. There's going to be condensation. The mask will get wet. They even play in colder weather, so I mean you can't have ice spilled up and things of that nature. But I think the big issue here is the condensation about that. Will that really render the mask less useful or useless at all? So.
And we don't see it in the colleges and pros teams doing that, but in part they do so much testing, including on game day testing now with antigens, and so antigen testing. So I think the high schools are probably in a little different position, and so I would say I kind of like the mask wearing thing, but I'm a lung doctor, so I would probably think that.
And I think more than those game situations or even in the practice situations, even on the practice field, if you need the strong coach, the strong administration to say, if you aren't doing drills, stay separated by 6, 8, 10 feet if you can. I can still talk to a group of people if they're separated by 6 to 8, 10 feet. If they're at practices and they're not doing the drills, then obviously have your mask up.
Yeah.
And whether that is the coaching staff who needs to lead that with coaching, wearing the mask properly, but then that will trickle down to their students. Playing the game with the mask on could be difficult. And, we've always said that doing any exercise is probably going to be a little bit more difficult with the mask.
It's harder, but it's not unsafe. And
it's
I
not
think
unsafe.
That's the key
Correct.
thing. It is not unsafe at all. So,
Suzanne wants to know, how do the doctors feel about volunteers returning to the hospital?
Ooh, that's a great question. Dr. Myers, what do you think about children's? Because you guys have a great volunteer program.
We do, and there's been a lot of discussion around that. We have missed our volunteers greatly. They do so many wonderful things for the babies and children here. I think that that is an ongoing discussion here, and I know that Child Life and the head of volunteer services is very excited to bring volunteers back. Now, on the other side, the volunteers also need to feel comfortable coming back too, and and being respectful of people's concerns around becoming ill. But I feel confident that when volunteers do come back, that they will be safe, based on how all the healthcare workers are masked. People are wearing eye protection around when they're in patient care areas, and enhanced cleaning and hand washing is happening. So once our volunteers are back on site, I think they'll be safe.
And Mark, how about over there at Truman? How are you guys going to handle volunteers? Because again, another organization that has a strong volunteer network.
Yeah, I agree with Dr. Myers. I mean, we've been having discussions about this and are likely going to have volunteers back. I mean, obviously each volunteer will have to decide if they feel comfortable coming back, but we certainly feel good about all the precautions that we have and the requirements of mask wearing and so forth. And so I think it is time for that to occur.
Yeah.
Yeah.
Where are we on that one, Dana?
We are still in the process of that, because I think we do know, we do understand that the volunteers are very important and do provide very important work. And if you are taking those precautions that we're talking about, the distancing, the masking, which everybody is doing here, you will be safe. We just really need to settle on, is it finally safe for our patients to bring extra people back? Because we know that when you have extra people, there's always a chance that one of those people
spread.
can have.
You got to make sure, how do you maintain distancing? How do you do in the cafeteria? Those are all the logistics of trying to work things out, right? That's so important. Okay.
Erica is a teacher in a rural district that she says that there's community spread and it's rampant. She says they're mostly non-mask wearers, and she said they don't quarantine. She is afraid, and she wanted to know what is everything she absolutely needs to do to stay safe in school. And do you have words of encouragement?
Okay, those are, and that is our big concern, is what's going on in the rural communities. Remember, on Wednesday we'll be broadcasting live from Hayes. I'll be out there with members of the Hayes medical community as well as folks back here in the studio. We'll be talking about what's going on in rural Kansas as an example, of what's going on in rural areas around our region. And so I think it is a problem, though, Hawk, because when this has gotten into rural communities, the mask wearing culture, by and large, has not been as strong. I was down in southern Missouri for a little bit this weekend, and gosh, not a lot of mask wearing down there. More than I had seen before when I was out there, though. I got to say, it's better than it was. I saw one window said of a card said the real pandemic is pedophilia, and while pedophilia is a problem, I don't think it's the same problem as the coronavirus
I don't think
pandemic.
But certainly we know, at this point in time in September of 2020, with the pandemic going on, not adhering to these public health guidance measures is really being myopic. It is kind of backward thinking. We know and understand what can stop the spread of disease, stop the spread, therefore, of hospitalizations and mortality. And when you just do have more people infected, although we have said from the beginning, the majority of people will not be too ill, there is that population and those subsets of populations who are more susceptible to having severe illness and death, and nobody wants that. What can you do to be safe? Just remember to adhere to those things that we've talked about. Certainly the masks are for barrier protection if you don't know you are ill and can spread the disease, but the masks, even the cloth face masks, will provide you protection as the wearer. In addition, a face shield or goggles will help if you are around people. But if you do have to go out when you really only have to. Maintain that distancing. If you are in the school setting, try and do that as much as possible. As you have been doing this for a week or two, it will become second nature. You will understand how to distance yourself from people as much as possible. We understand that from the engineering things and some of the classrooms and whatnot, it might be more difficult, but you will be able to kind of do that almost subconsciously, distance away, wearing the mask, wearing the eye protection. And it really does start from the top down, whether it's the hospital CEO, whether it's the school administrators, the superintendent, the school district, or the specific school itself. It does start with there. And so you need a strong message from those people as well.
And Dr. Myers, what do you say to those folks, and how do you get a 2-year-old or a 5-year-old to wear a mask?
Well, I don't think we do get many 2-year-olds to wear masks, but older toddlers and certainly school-age kids are capable of wearing a mask at school, and have been able to do so for the day with having breaks for recess and gym class and obviously lunch and things like that. Cohorting is really key as best you can, especially with elementary school kids, so that they stay with their same class the whole day, that they're not mixing with other classes. That helps reduce the risk of exposures and subsequent infections. Making sure that sick kids aren't coming to school is important. From what we've seen so far here at Children's Mercy, the schools are doing a phenomenal job of cohorting, of continuing physical distancing, of making sure that kids aren't there. And also, they're reaching out to us to ask questions when they don't know the right answer. So I feel very reassured that the schools are wanting to do the right thing, and they're doing everything in their power to support the learning of children while also protecting their teachers.
Yeah, that's such an important issue, isn't it? And so, Dr. Adega, I'm going to turn to you too, because I know in Liberty you guys kind of balance rural and urban, and how is that going, and what do you see coming from rural areas of Missouri?
Yeah, I hear this from the patients who get admitted, as well as some of our staff who live in the rural communities and send their own kids to the schools there. They notice the differences in the urban and the school and the rural atmosphere, and I hear the stories. And I think, as other speakers mentioned, I think we need to be really pushing for the leadership in those communities, whether it's the school district or the elected officials, to understand what's happening in our urban school districts and larger school districts, and how they've been able to manage it and trying to replicate that. We do have a lot of vulnerable patient population in the rural communities, and those are the ones who are going to be affected. It is an issue, and I totally agree with the recommendations for the schools. And here in our school districts, actually, the secondary school level, they've been doing the hybrid model. And so they're only 2 days in school and 3 days virtual. And then they've also given choices for certain parents to do virtual. That has decreased the number of students in each class. So they've been able to manage like 12, 13 students. So there is plenty of spacing that they can do, and pretty much everybody is doing math. Elementary kids are a little bit of a challenge in keeping them separate, but they've done reasonably well, and I think that's a model that can be replicated in rural communities as well. We need to spread the word.
Yeah, makes sense. Jill?
Joanne says that the Blue Valley School District just reported it had an elementary outbreak or cases in their elementary school. And she wants to know what should be happening. At what point do we think, doctors, that they should start doing remote learning?
Okay. Angela, this question is right at you, I think. And then we'll come back to Hawkeye and see what Larry's thinking up there at Shawnee Mission, too.
Sure. So this is a great question. My understanding, the school they're talking about had a one positive child, and there were potentially 100 exposures to that child. I don't know details around it or what the exposures entailed. I know that the school worked very closely with the Johnson County Health Department in making decisions around quarantining. So ideally, in an elementary school, you can cohort one class together so that they do all their specials, they do recess, they do lunch together. They're not mixing with other classes, so that if you have a positive case in that class, you can make decisions around quarantining that class, and then not shutting down an entire school. We are going to have cases. We're going to have cases all through the school year. So I think we need to think about at what point do we decide that we have to flip completely to remote learning. My hope is that the schools are able to do all the things they need to do to keep kids cohorted and quarantine the ones that were exposed while allowing the other children to come to school to continue learning that way rather than remotely, and be able to do that throughout the whole school year rather than having to shut down completely.
Yeah, that's a big deal. And Larry, I would think that in the Shawnee Mission area, et cetera, how do you see that playing out? Any risk to the adults?
Well, there's some certainly risks to the teachers if you have an outbreak, and so those individuals have some risk. I think also there's some risk just from the fact that the kids will bring it home. They may have parents, grandparents that then can also be at risk to some degree. I agree with Dr. Stevens. I think it's a tough question, and what to know using what criteria do you use for thresholds to continue learning in school if you've started that or started if you haven't. I'm of the opinion that I'd love to see the kids in school. I mean, that's just my personal opinion, but it's hard because there's so many different factors that are affected. We've had some good kind of laboratories of that. I think elementary schools across the nation have had more success, and even in Kansas City, the ones that have been open have had more success in controlling those cases than perhaps the secondary schools have. Just a personal note, my daughter has 5 children. She lives in Colorado Springs. She has 3 that are elementary school age and 1 that's in preschool. They all started school. They've been in school for about a month, and so far they're doing really well. They have not had any outbreaks, and so that's a positive for that, at least for that age group.
Well, and it can be done, and isn't it amazing? Because I would think schools would be like the massive cluster thing, and it would be difficult. But so far, we got our fingers crossed. I would say that I don't know, and I'll be curious to what anybody else on our panel says today. I don't think we're going to know until October, November, mid-October to November, because the real question I have is if kids get it and another kid gets it, they take it home, and pretty soon it spreads to other members of the family. So to me, it's going to take 6-8 weeks before we really know how this is progressing, and maybe even 3 months. But then we'll have a better sense of whether we succeeded or not. Thoughts from anybody about that?
Yeah, this is Ragodi. I totally agree with you. I think it's too soon to draw any conclusions yet in 2 to 3 weeks of schools having been open. So far, it all looks good, but I think we need to wait another month before being very confident.
Yep. Dr. Myers, I thought you started to say something there.
Yeah, I think that's correct thinking too. I also think that there's going to be a difference potentially based on the age of the kids. So what it appears related to COVID is that younger children are less likely to transmit infection than older children are. So I think we need to keep that in mind as well.
Yeah, so important. Okay, Jill.
Yeah, Elizabeth wants to know, what about having fans and open windows in classrooms and at home? She's worried about it spreading.
Fans and open windows. Okay, let's get into a little discussion because this whole thing came out again over the weekend about whether or not it's aerosol. I've been waiting for the question. So we're just going to grab that question and pull it in to this question. So, Larry, fans and open windows. You and I are both pulmonary guys. We've had to deal with particle size and droplet size on albuterol inhalers and everything else. What do you think about the stuff coming out from the CDC? What do you think about open windows and fans, which work until it's 10 degrees outside, just to say?
Right.
Oh, that's a tough question.
I know. That's why I gave it to you, Larry, because I'm your friend, and I'm going to watch out for you.
I know. Thank you, Steve. That's very good.
I know.
Certainly, it's going to aerosolize those things for a greater distance, but I think that for most instances, especially in private homes where you're just doing it for the fresh air and the cooling, I don't see a big problem with fans. I don't think that it's going to aerosolize or push anything far enough and for a long enough period of time that's going to be much of a risk for transmission. So, I don't know that there's any science to back that up, but I think just knowing, as you said, what happens with a cough and droplets and aerosolization, I'm not sure that there is a huge risk there.
Yeah, I think, the risk that I look at is like this. We've always known that being inside is being worse than outside. Things that we could do that create more airflow and thus dispersion of droplets or aerosolized particles is probably a good thing, probably not a bad thing. So I think open windows and fans are probably good things. Yeah. I'm not too worried about it blowing a breath cloud around. I think it disperses a breath cloud instead. And we know that intensity and duration of exposure probably are the real things that dictate it. Yeah. If it was simply pieces of virus hanging in the air, we'd all have had it by now.
Yep.
And so that's not how this thing has acted.
These wouldn't work.
Yeah, the masks wouldn't work. Things like that wouldn't work. So I think there's a balance. Is it hanging in the air? Sure. But that's not a surprise to any of us who practiced in the area of pulmonary and infectious disease for a long time. Is it going to be infectious to you and cause you to have a fatal illness because it's hanging in the air? Yeah, probably not. You probably have to have more intensity and duration. Mm-hmm. That's not to say that it can't happen, but the odds of it go down, I think, pretty dramatically if it's just a small amount of stuff hanging in the air versus a big breath cloud. So, Hawkeye, talk about that a little bit.
Yeah, I think that the comment or the headline was okay. I think you really need to look deeper into what they were saying, and I don't think what they were saying is any different than we have been saying.
No, it's not new news.
And I think a lot of this has come now, and this has never been a problem before COVID, but I think a lot of the problem is coming now, even in the medical profession, but also in the general public, between airborne and aerosolization, and these are getting intertwined. And as you said, this is not the distinct airborne that we see with something like measles, where you would have such high attack rates, 90% attack rates with that disease, because it can hang in the air, things of that nature. So this is not like that. I think what they were referring to, and they really did go into talk about microaerosols and things of that nature. With that turbulent flow that occurs outdoors or with fans or anything of that nature, you are going to disperse that those droplets in lower and lower concentrations. This goes back to those articles that we saw that they had seen it in the rooms or in other rooms or down the hallway where they could culture infective virus. Well, of course, but the concentration of that virus is so small. So I don't think that statement changes anything that we're doing, especially from a PPE standpoint in the healthcare setting. I don't think that changes our public health guidance. What they said was, well, maybe 6 feet isn't enough. But if you remember, we've been saying, okay, 6 feet, but if you can get 8 feet or 10 feet or more, that's good too. So that is just consistent with what we've been saying. I don't think that their change in language really changes anything at this point in time.
Dr. Myers, any other thoughts around that? And are masks still a good idea?
Masks are still a good idea. And I, too, do not have concerns around fans or open windows for kids in schools or on the school bus or for your own personal use at your home.
Yeah, Dr. Adega, I think it's still all good. Thoughts from your standpoint?
No, I think it's been mentioned. I totally agree with all the rest of the speakers. I think masks are still a good idea, and there is this concern about the inoculum size and infection. So I think they do help in reducing the amount of exposure.
And Mark, you and I think both we're helping large organizations. I'm impressed that mask wearing has made a huge difference in our organization. How about over at Truman?
Oh, no, absolutely. I mean, there's no question about that, and I think the evidence is very clear that wearing masks helps to protect us all and each other. I did want to comment a little bit about the rural stuff, and it just struck me that recently I was traveling through the state of Missouri and stopped in a rural community to get a carryout, and when I went in, none of the employees were wearing masks, and none of the people who were there dining were wearing masks. And I think that it's sort of unfortunate that it seems like that the illness has to sort of hit these communities and to create a wake-up call for people to really pay attention to this. And I did see something here recently where 3 communities in the state of Missouri were in the top 15 with the highest rates of infection currently. And so I think that it's going to be important for those communities to sort of buckle down. And this actually has impacted even my family. I have a brother who's a physician in a small town in Missouri, and obviously very, wears masks all the time, but he also has teenage kids in school who ended up contracting it, and then he and his wife got it. So all these things are sort of difficult problems, but really the mask wearing and the social distancing and being aware of your bubble and so forth are really important. And then the other thing, I just, social or personal responsibility. I saw the story where a teenager in Massachusetts actually was infected and was sent back to school. And so obviously those kind of things are not going to be helpful for the spread of this illness.
I hope your brother and his family are doing okay, because that's scary when it gets so close to you.
Yeah, no, fortunately they did okay, but it's you worry about it until they kind of get past it. So.
And I would like to piggyback on that, where even in some of our rural communities, you may not have great access to health care. And so you may have these underlying conditions that are either undiagnosed or not optimally treated, such as diabetes and lung disease and things like that. And that puts you at higher risk of severe disease as well.
Yeah, I think that's right. I know how to be in a rural community to find folks who don't manage or are not having their chronic diseases managed well.
We've got 2 people that are asking about transmission within a family. One has a young child that had it, and they want to know if someone else in the family gets this, does that child have to isolate, because presumably they're not going to get it again. And then Scott wanted to know if one person is not taking precautions and everyone else is in the family, if that person brings COVID home, does everyone need to isolate?
Okay, great question.
Or do you just punish the guy that brought it home, or girl?
Family dynamics and COVID, Dr. Adega, what do you think?
This is extremely difficult within the family to do those individual isolations. Some people, especially adults, might be able to do that by going into the basement and living out a couple of weeks there. But younger the person, it's going to be extremely difficult.
Yeah, I would say, Dr. Myers, how do you do that if the 7-year-old or the 8-year-old who needs care from the parents is the one with COVID?
you have to care for your children. You can't leave them to fend for themselves when they're 7 or 8. But you're just going to, wash your hands frequently and clean high touch surfaces and be as careful as you can. And if you do have a child at home who has COVID, then you yourself should be being careful and quarantining as much as possible at home for that 14-day window period to see if you're going to get ill or not. In reference to the young child with COVID who had COVID and the rest of the family did not, that child does not need to then isolate after getting over that infection after new family members then develop infection. They should have good immunity for a period of time, and they don't need to be re-isolated after they get over their infection.
All right. Well, let's get final thoughts from our panel this morning because we're going to be wrapping up. So, Larry, final thoughts over at Advent.
I think my final thought is just I think everybody needs to continue and I'd like to see everybody continue in our community as they have to do those infectious disease measures that have kept the disease at where it is right now. And I think if we can do that and continue to do that, then we're gonna be getting back to normal a lot faster. So keep wearing those masks, keep social distancing whenever possible, and just good hand hygiene.
It's so true. Mark?
I was going to say the exact same thing. Keep on wearing masks, keep on social distancing, and avoid large gatherings. These are the things that are proven to work currently, and hopefully we'll have a vaccine before too long.
Yeah, let's go vaccine. Now, Dr. Adiga.
Yeah, I agree. I think we are getting more and more proof of infection control measures working, and I think we need to spread the message to the communities that still haven't gotten that completely in a nice way, and spread it to the rural and areas that haven't gotten this yet.
Yep, Dr. Myers.
Sure. We've seen a glimmer in our community that things may be decreasing in terms of new cases. Our rolling day average for Johnson County is on the decrease for the last 14 days, but we still have some work to do to get it down even further. And while we're working on that, we also need to be getting our flu shots. We are not that far from flu season, and co-infections do occur with COVID, and so we want to take every precaution we can.
You bet. All right. Well, first of all, thank you very much to our outstanding panel of medical experts who have joined with us today. It is always a pleasure to have you all on the program, and I think it's great to have that community perspective. These guys folks have all been with us from the beginning. They've all been here before, so thank you. You'll be back. John Rule is a U.S. Army epidemiologist, and Mario Castro, Vice Chair for Clinical and Translational Research here at KU, will join us tomorrow to talk about the viral spread in our communities post-Labor Day and the start of school, and this is important, to share news of a study to test strategies and new therapies for COVID-19, as well as to talk a little bit about vaccines. So good stuff tomorrow. This will be a really important program. Here's some great photos, people wearing masks. Who would be wearing all those Jayhawks? Wearing a mask here in Virginia, protect themselves from others and to match the siblings in Kansas. Here's a picture of some folks vacationing in Frisco, Colorado, wearing a mask. So the businesses stay open and schools have a chance to continue to be open because it is that big a deal. Yep. And here's a family who COVID canceled granny basketball, but they wore masks so they could keep up their skills. Thanks a lot for all that. I have a special message for Dr. Hawkeye today, who did turn a year older. Old Man River, that old man River, he just keeps rolling. No Hawkeye rolling, he just keeps getting older every day. I hope you get older along with us. Be careful out there, wear your mask, stay distance, do the things you know to do so you can stay around as we cure a pandemic. And we get back to Chiefs football at Arrowhead. That's going to be so much fun. Big win yesterday. And, man, those guys make you nervous. We'll see you here tomorrow.